Have you ever gone to bed thinking you were doing everything right, only to discover that one seemingly harmless nighttime habit may be placing unnecessary stress on your heart and blood vessels? Most people believe heart attacks and strokes happen without warning. While they can occur suddenly, the body often sends signals long before a major event. Our daily habits, especially those in the hours before bedtime, can influence blood pressure, blood sugar, inflammation, sleep quality, and the workload placed on the heart. During a healthy night of sleep, your heart is supposed to enter one of the most important recovery periods of the entire day. While you rest, your body is far from inactive. In fact, countless repair processes are taking place behind the scenes. Your brain organizes memories, your immune system performs essential maintenance, your hormones follow carefully timed rhythms, and your cardiovascular system gets an opportunity to recover from the physical and emotional demands of the day. This natural recovery is one of the reasons why consistently getting enough quality sleep is associated with better long-term heart health. One of the most remarkable changes that occurs during healthy sleep is a gradual reduction in heart rate and blood pressure. As you move into deeper stages of sleep, your nervous system shifts away from the fight or flight mode that keeps you alert during the day. Instead, the parasympathetic nervous system becomes more active. This calming branch of the nervous system helps slow the heartbeat, relax blood vessels, and reduce the workload placed on the heart. Think of it as giving your heart a well-earned opportunity to catch its breath after working continuously every second of your life. This nightly decline in blood pressure, sometimes called the nocturnal dip, is considered a healthy pattern for many people. During these hours, the heart doesn't have to pump against as much resistance, allowing the cardiovascular system to function more efficiently. Researchers have found that people who regularly experience this natural nighttime drop in blood pressure often have better cardiovascular outcomes than those whose blood pressure remains elevated throughout the night. However, many factors can interfere with this normal pattern, including poor sleep quality, chronic stress, certain medical conditions, and unhealthy evening habits. Sleep also influences hormones that play major roles in heart health. Cortisol, often referred to as the stress hormone, normally follows a daily rhythm. It decreases during the evening to help prepare the body for rest and gradually rises before morning to help you wake up. When sleep is disrupted or shortened, this rhythm can become unbalanced, leaving cortisol levels higher than they should be. Persistently elevated stress hormones may contribute to increased blood pressure, inflammation, and changes in blood sugar regulation, all of which can place additional strain on the cardiovascular system over time. Another important factor is inflammation. While inflammation is a normal part of healing, chronic low-grade inflammation has been linked to the development of atherosclerosis, the process in which fatty deposits gradually build up inside arteries. Healthy sleep appears to help regulate inflammatory responses, whereas insufficient or poor quality sleep has been associated with higher levels of inflammatory markers in many studies. Over months and years, ongoing inflammation can damage the delicate inner lining of blood vessels, making them less flexible and more vulnerable to plaque formation. Your blood vessels also rely on sleep to maintain healthy function. The inner lining of blood vessels, known as the endothelium, helps regulate circulation, blood clotting, and the widening or narrowing of arteries. Healthy endothelial function supports smooth blood flow throughout the body. Poor sleep, frequent nighttime awakenings, or conditions like untreated sleep apnea may impair this function, reducing the ability of blood vessels to relax properly. This can contribute to higher blood pressure and increased stress on the heart. Breathing patterns during sleep are equally important. In healthy sleep, oxygen levels remain relatively stable as your body continues delivering oxygen-rich blood to every organ. However, repeated interruptions in breathing, such as those seen in obstructive sleep apnea, can cause oxygen levels to drop temporarily many times throughout the night. Each episode forces the body to respond by releasing stress hormones, increasing heart rate, and raising blood pressure. Over time, this repeated cycle may contribute to a higher risk of hypertension, abnormal heart rhythms, heart disease, and stroke if left untreated. Blood sugar regulation also continues while you sleep. During restful sleep, your body carefully balances hormones involved in glucose metabolism. Poor sleep can reduce insulin sensitivity, making it more difficult for cells to use glucose effectively. Persistently elevated blood sugar can damage blood vessels and accelerate the development of cardiovascular disease, especially in people with diabetes or prediabetes. The quality of sleep matters just as much as the number of hours. Someone who spends 8 hours in bed but experiences constant interruptions, loud snoring, or repeated awakenings may not receive the same cardiovascular benefits as someone who sleeps soundly through the night. Deep, restorative sleep allows the body to complete the repair processes that protect the heart, blood vessels, and brain. Understanding what normally happens during sleep helps explain why nighttime deserves so much attention when discussing heart health. The hours you spend asleep are not simply a pause in your day. They are an active period of recovery that supports healthy blood pressure, balanced hormones, efficient circulation, and normal cardiovascular function. Protecting this natural recovery process through healthy sleep habits is one of the simplest yet most valuable investments you can make in your long-term health. Many people think the most dangerous choices for heart health happen during the day, but one of the most overlooked risk factors often occurs just a few hours before bedtime, eating a heavy, late-night meal. It may seem harmless to enjoy a large dinner or indulge in snacks while watching television, especially after a long day. However, your body follows a natural internal clock, known as the circadian rhythm, which influences digestion, metabolism, hormone release, and even cardiovascular function. When you consume a large high-fat, high-sugar, or high-salt meal late at night, you may be asking your body to perform demanding digestive work at a time when it is naturally preparing for rest. Digestion requires energy and increased blood flow to the stomach and intestines. Instead of allowing your heart rate and blood pressure to gradually decrease as bedtime approaches, a heavy meal can keep your digestive system highly active. Your heart continues working to support this process, delaying the normal period of cardiovascular recovery that should occur during sleep. While this may not cause immediate problems in a healthy person, repeating this habit night after night can contribute to long-term cardiovascular stress, particularly in individuals who already have risk factors. Large meals that are rich in refined carbohydrates and added sugars can also cause significant increases in blood glucose. In response, your pancreas releases insulin to help move sugar from the bloodstream into cells. Frequent spikes in blood sugar and insulin may contribute to insulin resistance over time, a condition that increases the risk of type 2 diabetes. Diabetes is one of the strongest risk factors for heart disease and stroke because chronically elevated blood sugar can damage blood vessels throughout the body. Salt is another hidden concern in many late-night meals. Fast food, processed snacks, instant noodles, frozen meals, and restaurant takeout often contain large amounts of sodium. Excess sodium encourages the body to retain water, increasing blood volume and placing extra pressure on blood vessel walls. For people who already have high blood pressure, this additional strain can make nighttime blood pressure remain elevated instead of following its normal decline during sleep. Persistently high blood pressure is a major contributor to both heart attacks and strokes. Heavy meals close to bedtime can also interfere with sleep quality. Lying down soon after eating increases the likelihood of acid reflux, sometimes called heartburn, because stomach contents can move back into the esophagus more easily. Discomfort from reflux may cause repeated awakenings during the night, preventing the deep, restorative sleep that supports healthy cardiovascular function. Poor sleep itself has been associated with increased blood pressure, higher stress hormone levels, and greater inflammation. Foods high in saturated fat may also have short-term effects on blood vessel function. After consuming a very fatty meal, blood triglyceride levels temporarily rise as the body processes dietary fat. Some research suggests that these temporary increases may reduce the ability of blood vessels to relax efficiently for several hours. While occasional indulgences are unlikely to cause major harm, making this a nightly routine may contribute to long-term vascular health problems when combined with other unhealthy lifestyle factors. Late-night eating often goes hand in hand with other habits that further increase cardiovascular risk. People who snack late into the evening may be more likely to remain sedentary, sleep fewer hours, consume alcohol, or choose highly processed foods instead of balanced meals. Over months and years, these behaviors can promote weight gain, elevated cholesterol, high blood pressure, and chronic inflammation, all recognized contributors to cardiovascular disease. It's important to understand that eating before bed does not automatically lead to a heart attack or stroke. The body is remarkably resilient, and occasional late meals are part of normal life for many people. The concern lies in making large, unhealthy nighttime meals a consistent pattern, especially if someone already has conditions such as obesity, diabetes, hypertension, or high cholesterol. In these individuals, reducing late-night eating may be one helpful strategy among many to support better heart health. If you become hungry in the evening, a small, balanced snack is generally a better choice than a large meal. Foods that contain fiber, healthy fats, or modest amounts of protein, such as plain yogurt, a handful of unsalted nuts, or a piece of fruit, are often easier for the body to handle than greasy fast food, sugary desserts, or oversized portions. Finishing dinner at least 2 to 3 hours before going to bed also gives your digestive system time to process food before you lie down, allowing your heart and the rest of your body to transition more naturally into the restorative state that healthy sleep is meant to provide. The connection between unhealthy nighttime habits and cardiovascular disease is not based on a single event. Instead, it develops gradually through a series of biological changes that place increasing stress on the heart, blood vessels, and brain. A heart attack or stroke rarely occurs because of one isolated meal or one poor night's sleep. More often, these emergencies are the result of damage that has accumulated over many years. Understanding these processes can help explain why seemingly small habits deserve attention before they become larger health problems. One of the most important factors is high blood pressure. Healthy arteries are flexible and allow blood to flow smoothly throughout the body. However, when blood pressure remains elevated over time, the constant force against artery walls causes microscopic damage. The body attempts to repair this damage, but repeated injury can lead to stiffening and thickening of the arteries. As they become less flexible, the heart must work harder to pump blood, increasing its workload day after day. Over many years, this persistent strain raises the risk of heart failure, heart attack, and stroke. Inflammation also plays a significant role. Although inflammation is part of the body's normal healing response, chronic low-grade inflammation can become harmful. Poor lifestyle habits, including unhealthy eating patterns, smoking, lack of exercise, chronic stress, and inadequate sleep, may contribute to ongoing inflammation within blood vessels. This inflammation affects the delicate inner lining of the arteries, known as the endothelium. When the endothelium is damaged, cholesterol and other substances are more likely to accumulate beneath its surface. Over time, these fatty deposits form plaques in a process called atherosclerosis. At first, these plaques may not cause any noticeable symptoms. Blood continues flowing through the arteries, and many people feel completely healthy. However, as plaques enlarge, they gradually narrow the arteries, reducing the amount of oxygen-rich blood that can reach the heart muscle or the brain. This narrowing may remain silent for years before symptoms appear. The greatest danger often occurs when one of these plaques becomes unstable. If the protective outer layer of a plaque ruptures, the body interprets it as an injury and immediately begins forming a blood clot. While clotting is essential for stopping bleeding after an external injury, a clot forming inside a narrowed artery can suddenly block blood flow. If the blockage occurs in a coronary artery supplying the heart muscle is deprived of oxygen, resulting in a heart attack. If the blockage occurs in an artery supplying the brain tissue begins to die within minutes, leading to an ischemic stroke. Blood sugar is another important contributor. Frequent spikes in glucose, especially in people with diabetes or insulin resistance, can damage blood vessels throughout the body. Elevated blood sugar promotes oxidative stress and inflammation, making arteries more vulnerable to plaque formation. It also affects the normal function of the endothelium, reducing its ability to relax blood vessels and regulate healthy circulation. Over time, this damage accelerates the progression of cardiovascular disease. Poor sleep further adds to these risks. During restful sleep, blood pressure and heart rate normally decline, giving the cardiovascular system an opportunity to recover. When sleep is repeatedly interrupted or shortened, stress hormones such as cortisol and adrenaline may remain elevated. These hormones increase heart rate, constrict blood vessels, and raise blood pressure. Chronic activation of this stress response can contribute to long-term cardiovascular damage. Certain sleep disorders, particularly obstructive sleep apnea, deserve special attention. In sleep apnea, breathing repeatedly stops and starts throughout the night, causing temporary drops in blood oxygen levels. Each episode forces the body to respond by releasing stress hormones and increasing blood pressure. Over months and years, untreated sleep apnea has been associated with hypertension, irregular heart rhythms, heart failure, stroke, and other cardiovascular conditions. Blood clotting itself can also be influenced by overall health. Chronic inflammation, smoking, obesity, diabetes, and physical inactivity may make the blood more likely to clot under certain circumstances. When combined with unstable plaques inside arteries, this increased tendency toward clot formation creates a higher risk of sudden cardiovascular events. It's important to remember that these processes rarely act alone. High blood pressure, elevated cholesterol, inflammation, insulin resistance, poor sleep, smoking, excess body weight, and lack of physical activity often reinforce one another. Each factor adds another layer of stress to the cardiovascular system. While no single habit guarantees a heart attack or stroke, the combination of multiple risk factors can significantly increase the likelihood of these life-threatening events over time. The encouraging news is that many of these risks can be reduced through consistent lifestyle improvements, regular medical care, and early management of conditions such as hypertension, diabetes, and high cholesterol. One of the greatest challenges in preventing heart attacks and strokes is that the body often gives subtle warning signs long before a serious event occurs. Unfortunately, these symptoms are easy to dismiss because they may seem unrelated, appear only occasionally, or develop gradually over time. Many people assume they will experience dramatic chest pain before a heart attack or obvious paralysis before a stroke. While these classic symptoms can occur, the body frequently provides earlier clues that something may not be functioning as it should. Paying attention to these warning signs and discussing them with a healthcare professional can lead to earlier evaluation and treatment. High blood pressure is often called the silent killer because it usually causes no noticeable symptoms, even when it reaches dangerous levels. A person may feel completely normal while elevated pressure is gradually damaging the arteries, heart, kidneys, and brain. This is why regular blood pressure checks are so important, especially after the age of 40 or for anyone with diabetes, obesity, or a family history of cardiovascular disease. Detecting high blood pressure early allows it to be managed before it contributes to more serious complications. Chest discomfort should never be ignored, even if it seems mild. Not every heart problem causes intense pain. Some people experience a feeling of pressure, tightness, squeezing, fullness, or burning in the center of the chest. Others describe it as heaviness or an uncomfortable sensation that comes and goes. The discomfort may spread to the shoulders, arms, neck, jaw, or upper back. These symptoms may appear during physical activity, emotional stress, or even while resting. Because heart-related chest discomfort can vary from person to person, especially in older adults and women, it is important to seek prompt medical evaluation if it is new, persistent, or concerning. Shortness of breath is another symptom that deserves attention. If climbing a flight of stairs suddenly becomes much more difficult than before, or if you become breathless while performing routine activities, it may indicate that the heart is struggling to pump blood efficiently. In some cases, shortness of breath occurs even while lying flat or during sleep. Although many conditions can cause breathing difficulties, persistent or unexplained shortness of breath should always be evaluated by a healthcare professional. Fatigue that seems out of proportion to daily activities can also be an early warning sign. While everyone feels tired occasionally, persistent exhaustion without an obvious explanation may indicate that the heart is working harder than normal. Some people notice they no longer have the energy to complete tasks they once handled easily. Others find themselves needing frequent rest breaks during simple activities. Although fatigue has many possible causes, it should not be ignored when accompanied by other cardiovascular risk factors. Irregular heartbeats or palpitations are another important clue. Many people occasionally notice their heart skipping a beat or beating faster after exercise or emotional stress. However, frequent episodes of rapid fluttering or irregular heart rhythms may require medical evaluation. Certain abnormal heart rhythms, such as atrial fibrillation, increase the risk of stroke because they can allow blood clots to form inside the heart, which may then travel to the brain. Sleep can reveal valuable information about cardiovascular health. Loud snoring accompanied by pauses in breathing or gasping during the night may suggest obstructive sleep apnea. People with sleep apnea often wake feeling unrefreshed despite spending many hours in bed. Morning headaches, excessive daytime sleepiness, difficulty concentrating, and waking with a dry mouth are additional signs. Untreated sleep apnea has been linked to high blood pressure, abnormal heart rhythms, heart disease, and stroke, making proper diagnosis and treatment especially important. Swelling in the feet, ankles, or lower legs may also signal that the heart is not pumping effectively. When circulation becomes less efficient, Fluid can accumulate in the tissues, particularly toward the end of the day. Although swelling may result from many non-cardiac conditions, persistent or worsening swelling should be discussed with a healthcare professional. It is equally important to recognize the warning signs of a stroke. Sudden weakness or numbness affecting one side of the face, arm, or leg, difficulty speaking or understanding speech, sudden vision changes, severe dizziness, loss of balance, or an abrupt, unusually severe headache require immediate emergency medical attention. Every minute matters because restoring blood flow quickly can reduce permanent brain damage. Listening to these warning signs does not mean assuming the worst. Many symptoms have causes that are not related to heart disease or stroke. However, ignoring persistent or unexplained changes may delay diagnosis of conditions that are highly treatable when detected early. Regular medical checkups, monitoring blood pressure, controlling cholesterol and blood sugar, and seeking prompt evaluation for concerning symptoms are among the most effective ways to protect both the heart and the brain. Not everyone has the same likelihood of developing heart disease or experiencing a stroke. Some people carry a much higher risk because of a combination of age, genetics, medical conditions, and lifestyle habits. Understanding who falls into these higher risk groups is not about creating fear. Instead, it allows people to take preventive steps before a serious health event occurs. The encouraging news is that even if you belong to one or more of these groups, many risk factors can be improved through healthy daily choices and appropriate medical care. Binge is one of the strongest risk factors. As we grow older, our blood vessels naturally lose some of their flexibility. Over time, years of exposure to blood pressure, cholesterol, inflammation, and environmental factors can gradually damage the arteries. This makes plaque buildup more likely and increases the chance that blood vessels may become narrowed or blocked. Although heart attacks and strokes can occur in younger adults, they become significantly more common after the age of 50, with the risk continuing to rise in later decades of life. Aging itself cannot be changed, but maintaining healthy habits becomes even more valuable as the years pass. People with high blood pressure face another major challenge. Hypertension often develops silently, without noticeable symptoms, while continuously placing stress on artery walls. Every heartbeat pushes blood through the vessels under greater force than intended, gradually damaging their delicate inner lining. This damage encourages plaque formation and makes blood vessels more vulnerable to narrowing and clot formation. Proper blood pressure control, whether through lifestyle changes, medication, or both, is one of the most effective ways to reduce the risk of heart attacks and strokes. Diabetes is another condition that deserves special attention. Elevated blood sugar can injure blood vessels throughout the body, affecting the heart, brain, kidneys, eyes, and nerves. Over time, diabetes accelerates the development of atherosclerosis, the process in which fatty plaques build up inside arteries. It also increases inflammation and can make blood clotting more likely under certain circumstances. People with diabetes are therefore encouraged to manage their blood sugar carefully through balanced nutrition, physical activity, regular monitoring, and prescribed medications when needed. High cholesterol is equally important. Cholesterol itself is essential for many normal body functions, but excessive levels of low-density lipoprotein, often called LDL cholesterol, can contribute to plaque formation within artery walls. As these plaques enlarge over many years, blood flow becomes increasingly restricted. If a plaque ruptures, a clot can form rapidly and completely block an artery supplying the heart or brain. Regular cholesterol testing allows healthcare professionals to identify elevated levels early and recommend dietary changes, exercise, or medications when appropriate. Smoking remains one of the most preventable causes of cardiovascular disease. Cigarette smoke contains thousands of chemicals that damage blood vessels, promote inflammation, increase blood pressure, and reduce the amount of oxygen carried by the blood. Smoking also makes blood more likely to clot and accelerates plaque buildup inside arteries. The good news is that the body begins repairing itself soon after smoking stops. Over time, the risk of heart disease and stroke gradually declines, demonstrating that it is never too late to benefit from quitting. Excess body weight, particularly when fat accumulates around the abdomen, is associated with several cardiovascular risk factors occurring together. Individuals who are overweight are more likely to develop high blood pressure, insulin resistance, type 2 diabetes, abnormal cholesterol levels, and sleep apnea. Each of these conditions independently increases cardiovascular risk, and together they place even greater strain on the heart and blood vessels. Even modest weight loss achieved through sustainable lifestyle changes can improve many of these health markers. Physical inactivity is another contributor that often goes unnoticed. Regular movement supports healthy circulation, helps control blood pressure, improves cholesterol balance, enhances insulin sensitivity, and strengthens the heart muscle. In contrast, spending long periods sitting with very little physical activity allows many cardiovascular risk factors to worsen over time. Even simple activities such as brisk walking, gardening, cycling, or swimming can provide meaningful health benefits when performed consistently. Family history also plays a role. People whose parents or siblings developed heart disease or stroke at relatively young ages may inherit a greater susceptibility to certain cardiovascular conditions. Genetics cannot be changed, but knowing about this increased risk allows individuals to adopt healthier habits earlier and seek appropriate screening from their healthcare providers. Finally, many people have several risk factors at the same time. An older adult who has high blood pressure, diabetes, elevated cholesterol, excess weight, and a history of smoking carries a much greater overall risk than someone with only one of these conditions. The effects are often additive rather than isolated. This is why comprehensive prevention matters. Managing blood pressure, controlling blood sugar, maintaining healthy cholesterol levels, staying physically active, eating a balanced diet, avoiding tobacco, limiting alcohol, getting sufficient sleep, and following medical advice all work together to protect the heart and brain. Even small improvements in multiple areas can substantially reduce long-term cardiovascular risk and improve overall quality of life. The hours before bedtime provide an opportunity to prepare your body for one of its most important recovery periods. While many people focus on what they do during the day to protect their heart, the evening routine deserves equal attention. Small, consistent habits practiced every night can support healthy blood pressure, improve sleep quality, reduce stress, and allow the cardiovascular system to recover more effectively. These changes do not require expensive equipment or complicated diets. Instead, they involve creating a routine that works with your body's natural rhythms rather than against them. One of the simplest and most beneficial habits is finishing dinner at least 2 to 3 hours before going to bed. This gives your digestive system enough time to process food before you lie down. Eating too close to bedtime may increase the likelihood of acid reflux, disrupt sleep, and keep your metabolism working harder when your body should be preparing for rest. Choosing a balanced evening meal that includes vegetables, whole grains, lean protein, and healthy fats can help provide steady energy without placing unnecessary stress on the digestive system. Portion size matters just as much as food choice. Even healthy foods can become problematic when eaten in very large amounts late at night. A moderate meal allows digestion to proceed comfortably while reducing the chances of blood sugar spikes or discomfort during sleep. If you become hungry later in the evening, consider a light snack rather than another full meal. Options such as plain yogurt, a small handful of unsalted nuts, or a piece of fruit are generally more supportive of overall health than highly processed snacks loaded with sugar, salt, or saturated fat. Limiting sodium intake during the evening is another practical step. Many processed foods contain surprisingly high amounts of salt, which can contribute to water retention and elevated blood pressure. Reading food labels and preparing more meals at home allows you to better control the amount of sodium you consume. Flavoring foods with herbs, spices, garlic, lemon juice, or vinegar instead of excessive salt can make meals enjoyable while supporting heart health. Hydration also deserves attention. Drinking enough water throughout the day supports healthy circulation and normal body function. However, consuming very large amounts of fluid immediately before bedtime may increase the need to wake during the night to use the bathroom, interrupting restful sleep. A balanced approach is to stay well hydrated during the day, while reducing excessive fluid intake during the final hour or two before going to bed. Unless your healthcare provider has given different advice for a specific medical condition, avoiding tobacco products is one of the most powerful decisions anyone can make for cardiovascular health. Smoking damages blood vessels, increases blood pressure, reduces oxygen delivery, and promotes clot formation. There is no safe time of day to smoke, but avoiding cigarettes before bed also helps prevent nicotine from stimulating the nervous system when the body should be relaxing. People who stop smoking often experience gradual improvements in circulation and significantly lower cardiovascular risk over time. Alcohol deserves careful consideration as well. Some people believe that alcohol helps them sleep, But while it may make a person feel drowsy initially, it often disrupts the quality of sleep later in the night. Alcohol can increase nighttime awakenings, worsen snoring, and aggravate obstructive sleep apnea in susceptible individuals. For those who choose to drink, moderation is important, and avoiding alcohol close to bedtime may improve sleep quality. Creating a consistent sleep schedule is another habit that benefits both the heart and the brain. Going to bed and waking up at approximately the same time each day helps regulate the body's internal clock. Regular sleep patterns support healthy hormone production, blood pressure regulation, and overall metabolic function. Even on weekends, maintaining a relatively consistent schedule can improve the quality of restorative sleep. The hour before bedtime is also an ideal time to reduce stress. Emotional stress activates the body's fight or flight response, increasing heart rate and blood pressure. Gentle relaxation techniques such as deep breathing, reading a book, stretching, meditation, or listening to calming music can help signal to the nervous system that it is time to rest. Reducing exposure to emotionally stimulating news, stressful work, or intense social media discussions immediately before bed may also promote a more peaceful transition into sleep. Finally, creating a sleep-friendly environment can make a meaningful difference. A quiet, cool, and dark bedroom supports deeper sleep by minimizing interruptions. Comfortable bedding, limiting unnecessary noise, and reducing bright light from electronic devices before bedtime can help the brain produce melatonin, the hormone that promotes healthy sleep. These simple evening habits may appear small on their own, but practiced consistently over months and years, they work together to support healthier blood vessels, better blood pressure control, improved sleep quality, and a stronger cardiovascular system. Protecting your heart does not require changing your entire life overnight. In fact, the most successful approach is often the simplest. Make one meaningful improvement, repeat it consistently, and gradually build upon it. Heart attacks and strokes usually develop after years of multiple risk factors working together. So prevention also works best when several healthy habits support one another. Rather than searching for a single miracle food or one perfect supplement, focus on creating a daily routine that helps your heart function efficiently for years to come. A good place to begin is by taking an honest look at your current bedtime routine. Ask yourself a few simple questions. Do you eat large meals just before going to bed? Do you stay awake scrolling through your phone until after midnight? Do you often snack on highly processed foods while watching television? Do you smoke or drink alcohol late in the evening? Small habits repeated every night can gradually influence blood pressure, sleep quality, body weight, and overall cardiovascular health. Recognizing these patterns is the first step toward improving them. If you identify one unhealthy habit, resist the temptation to change everything at once. Instead, choose a single goal for the next week. For example, decide to finish dinner at least 3 hours before bedtime. Replace sugary evening snacks with healthier options. So establish a consistent bedtime. Once that habit becomes part of your routine, introduce another positive change. Sustainable progress is built through consistency rather than perfection. Monitoring your blood pressure is another practical step that many people overlook. Because high blood pressure often causes no symptoms, regular measurement is one of the most valuable tools for protecting your heart and brain. If you have access to a home blood pressure monitor, learn how to use it correctly and keep a simple record of your readings. If your numbers remain consistently elevated, discuss them with your healthcare professional rather than waiting until symptoms appear. Early treatment can significantly reduce the risk of heart attacks, strokes, kidney disease, and heart failure. Physical activity should also become a regular part of daily life. You do not need to become an athlete to strengthen your heart. Activities such as brisk walking, cycling, swimming, gardening, or even dancing can improve circulation, lower blood pressure, help manage body weight, and improve blood sugar control. Health organizations generally recommend aiming for at least 150 minutes of moderate-intensity physical activity each week, along with muscle-strengthening exercises on 2 or more days if appropriate for your health. If you have an existing medical condition, consult your healthcare provider before beginning a new exercise program. Nutrition remains one of the foundations of cardiovascular health. Filling your plate with vegetables, fruits, whole grains, beans, nuts, lean proteins, and healthy fats provides nutrients that support healthy blood vessels and reduce inflammation. Limiting foods that are high in added sugars, excessive sodium, and saturated fats can help control cholesterol, blood pressure, and body weight. There is no single perfect diet that fits everyone, but consistently choosing minimally processed, nutrient-rich foods is a pattern supported by a large body of scientific evidence. If your healthcare professional has prescribed medication for high blood pressure, diabetes, high cholesterol, or another cardiovascular condition, taking it as directed is extremely important. Some people stop taking medication when they begin to feel better, believing the problem has disappeared. In many cases, however, the medication is the reason blood pressure or cholesterol remains under control. Never stop or change prescribed medication without first discussing it with your healthcare provider. Learning to recognize the warning signs of a heart attack and stroke can also save lives. Chest pressure, pain spreading to the arm or jaw, sudden shortness of breath, or unexplained sweating may signal a heart attack. Sudden weakness on one side of the body, difficulty speaking, facial drooping, vision changes, or loss of balance may indicate a stroke. These symptoms require immediate emergency medical attention. Acting quickly can preserve heart muscle, protect brain tissue, and greatly improve the chances of recovery. Finally, remember that heart health is not determined by one decision or one difficult day. It is shaped by thousands of everyday choices made over months and years. Every healthy meal, every evening walk, every cigarette not smoked, every good night's sleep, and every medical checkup contributes to a stronger cardiovascular system. You do not have to be perfect to make meaningful progress. Starting with one positive change today may seem small, but repeated consistently, those small actions can become powerful investments in a healthier heart, a healthier brain, and a longer, more active life.